This short demo is going to show you where to click on each screen as you complete the patient cases online. The basic screen layout involves a text-based description or narrative from the patient. This will be followed by a question asking you what decision or action you want to do next. You will then be given a series of options. You click on the option that you feel is the best next step to do. Your first task is to gather patient history as well as physical exam by clicking on the options below. Once you feel you've gathered enough information to make an early differential diagnosis list, select the option to move on to investigations, labs, and procedures. As soon as you do this, you'll be asked to put your differential into the system. You click Submit, and then you can begin your investigations. Now, once you get into the investigations section, there now becomes two layers of navigation. One that you see in the main area of the screen, and a second over on the right-hand side. The purpose is this. If you're in imaging, we want you to be able to quickly jump around and do the imaging investigations that you want to do. So, say you want to do a CT chest, you'll see the result, you'll see the findings, you'll see the cost, and the cost will also start accumulating down in this bottom right-hand corner. You then have the option to do other imaging, or if you are done with imaging, you can quickly jump to doing other types of investigations. So for example, you could come over and do labs. The way labs works is you check off those labs that you want to do, and as you check them off, you're going to see symbols and results. The symbols, like a check mark, mean it was a test that was appropriate to do, whereas an X means it's a test that wasn't necessary. If there is no symbol, it indicates the test was perhaps reasonable to do given the context of the patient. After each symbol, the lab result is described. The cost of the particular lab investigation is also given. You can keep selecting labs, and then when you're done, you can end the investigations or even do a second round of laboratory investigations. When you're done with all procedures, imaging, investigations, and consults, you can then click Done with Investigations to finish the case. Here you'll be prompted to enter in your differential one more time. Click Submit, and then to see the real answer to the case, click End and View Feedback. You'll also see your final total of costs, and then get to read through what an expert would have done in this case. Expert choices are summarized in the paragraphs you see here. And if you're curious, you can come down and look at the questions to see what you selected versus what was absolutely necessary in order to arrive at a correct diagnosis. The other elements of this page you can ignore, unless of course you want to rate the case, in which case you can come down here and give it a star rating and add any feedback. As much as we've shown you specifically where to click, we want you to really focus on the key goals for each case. The first is to gather sufficient information to create a strong differential diagnosis list. Use these cases as an opportunity to be thoughtful in selecting appropriate investigations and procedures, and reflect on how to be respectful of the patient, yet clinically thorough. Good luck, and please don't hesitate to give us feedback if there's issues with the cases or elements you think could be done better.